Hello, welcome to the training Immunization Law in Oregon Schools and Children's Facilities. My name is Stacy DeAssis Matthews. I'm with the Oregon Immunization Program, and I'll be doing this presentation today with Mallory Metzger. We're going to cover two pieces of the immunization process for schools and childcares. Part one, records, and part two, reports. In addition, this training includes information on how to get access to the Alert Immunization Information System. At the end of the training, you'll receive instructions for how you can get your own login to the Alert system. So starting off with records, what records do you need to collect as a school or childcare? Well, records include immunization dates, non-medical exemptions, medical exemptions, and immunity documentation. And we'll go over each of these in today's presentation. Where are immunizations required? In schools in Oregon, both public and private, and this includes online schools, and in children's facilities, which includes preschools, childcares, and Head Start programs. And who do you need to collect the immunization records for? Well, it's every child in your program, with a little asterisk because there are always exceptions to the rule. And so it's really every child in your program who will attend 5 or more days per school year, and who isn't counted by another site. And an example of this is if you're a daycare and you do after school care for some kids, those kids are counted by the school. So those kids will be not counted on your immunization report. And do you need records for students in online learning? And this is being recorded in late 2020 during COVID. So if you plan to reopen later this school year and you're in online learning now, yes, you need records for students who are in online learning, and you'll need to do your report in January. The answer is no if the student will be in online learning for the full school year. But we still encourage you to collect immunization records as preparation for next school year. When do you immunization immunization records? Well, the answer is before a child starts attending your program, but there's a little asterisk next to this as well, because it's almost always. There are exceptions for transfer students and students who are considered homeless. Transfer students you as a school will request a transfer record from the old school and will receive that immunization record in that transfer record. Students who are considered homeless under the McKinney-Vento Act, which is a federal law, you need to enroll those students immediately, and then Oregon law requires you to assist the families in coming up with an immunization record, and that could be looking the student up in the alert system to find the record there. It could be helping the family contact a previous school or medical provider to get a copy of the immunization record, or it could be connecting the family with immunization services like a local clinic where the student can get vaccines. So I want to talk about new enterers and the immunization requirements for these children. So a new enterer is someone who is starting preschool or childcare, someone who is starting kindergarten, someone entering any grade from outside the US, or entering any grade from homeschool. And new enterers must have one of the following before they begin attendance at your school or childcare: a record showing at least 1 dose of each vaccine that's required for the child's age. So they don't have to be totally up to date on their vaccines, but they need at least 1 dose of each vaccine, or an exemption. What records are required? Well, all shot dates must be on one of the following: either a certificate of immunization status form known as a CIS, or a printout from the Alert Immunization Information System. Here's what the CIS form looks like. On the front are the required vaccines, and on the back there's a space for recommended vaccines, a space for non-medical exemption documentation, and information about medical exemptions and immunity documentation. I wanted to talk a little bit about a non-medical exemption. This is the most common type of exemption in Oregon schools and childcares. It requires 2 pieces of documentation, and this is a zoom in of the back of the certificate of immunization status form and the piece that the parent needs to fill out. It says, I have attached the required document from either a healthcare practitioner or a vaccine education module. So the parent needs to check one of those 2 boxes. And then they need to check the boxes for which vaccine or vaccines they would like to claim the exemption for and sign this form. It's really important to get the signature on the certificate of immunization status form because this is the form that the parent acknowledges. If there's a case of disease in the school or childcare, then their child, if they have an exemption for that vaccine, may have to stay home for a certain period of time until the risk of that disease has passed. All right, so we talked about the first document needed for non-medical exemptions. That was filling out that piece of the CIS form. The second piece is the vaccine education certificate. And this is a form that a parent will get either from getting a little bit of education from a healthcare practitioner, and that form looks like this, or from printing out a vaccine education certificate after watching Oregon's online module for vaccine education. So you need one of these 2 forms in addition to that certificate of immunization status form for a non-medical exemption. Medical exemptions are much less common in Oregon. They need to be signed by a physician, list a specific medical reason, and if you get a medical exemption, send a copy of that to the local health department for review, and they will let you know whether it is a temporary or a permanent medical exemption. Immunity documentation is another type of record, and that's used when a child has either had a disease or has a blood test showing results of immunity. And instead of an exemption, children are counted as complete if they have immunity documentation. And we'll talk more about the complete category when we get to the immunization reporting forms. So how do you assess an immunization record? So for the immunization dates, there are 3 main ways. So number 1 is if you are a school that uses an approved computer system, a student information system in Oregon, those can do the immunization assessment, and they are programmed to tell you which vaccines a student is due for. The second manner is via transparent overlays. It's an overlay that fits on top of the certificate of immunization status form that can show what a child is due for. If you're interested in this, please contact your local health department. And the third is via the Alert Immunization Information System, Alert IIS. And with that, Mallory is going to show you how to use the Alert system.
Thanks, Stacy. Let me just pull it up real quick. I'm gonna log on, and then I'll share my screen. Okay. Been taking a second to log on today. Okay. So to log into Iris, or to Alert, sorry, you'll get a 3-part login. There will be an organization code that is connected to your school or childcare, a username, and a password. Once you type those in, make this a little bigger for everybody to see. Is that good, Stacy? Okay. You're going to have 3 options for what you can do in Alert. You can find a student, and that's to find their immunization record. You can create a list of those students. You can add them all to a list, and then you can run reports. So we're going to start by creating a list so that when we look up the kids, the students in our school or childcare, we can add them to something. We have something to add them to. So to do that, you go to Manage List, and you're going to create a new list name. So you can create up to 13 different lists. So if you have a childcare and you have different ages, you could do it by age, you could do it by room, however you would like. I'm going to call this one Wednesday. Okay, and hit save. And now we have our Wednesday class, and we are going to look up kids and add it to the class. So to do that, we're going to go to Find Student. And here's how you search. You always need a birth date to find a record. And then you need to have the name. And you can look up by the first or the last name, and you don't even need to type in the whole first or last name, just part of it. So I've got my school roster here, and I'm going to look up my first student, Earl Gray. So I'm going to type in the first 3 letters of the last name and the birth date, and then hit find. And you can see in the system, there's 2 kids with that birth date with the first 3 letters being the same. So I look to find the one who's actually in my school, and it's Earl. So I click on the record, and there is Earl's immunization record. Here are all the shots that Earl has gotten, and then at the bottom is what Earl is due for, or what vaccines he is complete for. So anything in green means that Earl can go and get that vaccine now. Green means go. So I want to show you a couple really important pieces to the record. So here is the reports function. So to add Earl to our class, we're going to pick a report list, find Wednesday's class, and then hit add the student to the report list. Now Earl is added. One way to check that is to go back to the report list, and if your class is no longer there, your report list is gone, that means your student has already been added. So the one other feature I want to show you, actually 2 more on this, is the tracking schedule. So the tracking schedule is how that bottom piece of the record telling you what they're complete for and what they're due for is being looked at. So ACIP is the clinic's schedule that they look at. So if they go into the doctor's office, what would the doctor or the nurse recommend Earl get? You're going to want to change it to the appropriate tracking schedule for how old this child is. So Earl is in my preschool. And right now you have to click it twice. Sometimes that takes a second time to make that tracking schedule stick. But once that happens, if you go down to the bottom, you can see this section looks completely different. Now, Earl is just due for the hepatitis A, because the school schedule is different than the clinic schedule. Okay, the last thing I wanted to show you on this record is if you wanted to print this record just as it is and give it to Earl's parents and say, hey, here, look, Earl needs a hepatitis A, you print confidential. But if you hit school record, I'll make this bigger for you, those vaccine dates get pre-filled into that CIS form with all the dates already added in, and in the signature line, it says printed from Alert IIS with the date. So what that means is you don't need a parent signature because all these dates have been verified already by a medical provider. So you can print this off and put it in your record for that student. Okay, let's look up a few more kids in our school. So we're gonna go to Find Student. I'm gonna look up the second kid. Okay, I'm looking up Ruby Red here. And it just went right to her record. Make this a little bigger here. So when there's an exact match, there's only one kid with those letters and the name and that birth date, it will go right to it. So check to make sure it's the right kid. We're going to add Ruby to our report list. Make sure it's on the right tracking schedule. Yes. She's a very old preschooler. And look at the bottom, and she's complete. Okay, we're going to find our third student. Forest Green here. Okay. There's two kids with those letters. We're going to pick the right one. And this record shows that the patient has had no immunizations associated with it, and then that they're due for everything. So a couple reasons why this could be that this child has never gotten any vaccines, so they don't have any. We get names from the Oregon birth certificates. So if this kid is born in Oregon, they will be in alert, but they didn't get any immunizations. Another reason there could be no immunizations is that maybe this kid was born in Oregon, but then they moved to another state and just moved back. And all those, this is a registry of shots given in Oregon. You can get shots given elsewhere added to the system. You just need to give it to a healthcare provider, your record from out of state, and they can add it for you. Or your local health department might be able to if you check with them. Okay, so we're gonna add Forest to our class. And then again, there we go. Nothing's changed, still no shots. Okay, so now that I've added all three of my kids to the report of my school, I'm gonna go and run some different assessments on these report or on this list. So we're gonna go back to Manage List, and we can see a Wednesday class. It has 3 kids. That's great. We're gonna click on that. And you can see here are 3 kids that we added. And then there's 3 different reports that you can run on these kids. One is a student list, just their name and date of birth of everybody in your report list. Then there's one where it's every kid and their immunizations and what they're due for on one page. So it's 1 page per kid. And then the third report is immunizations due. So that's the one that's going to probably be most helpful. And that is, out of all these kids, who's due for shots? That's really helpful. The one thing you want to make sure is that you change it to the correct tracking schedule. Because if you left it on ACIP and you said, what are they due for? That's going to look at what would they be due for if they went to the doctor's office. And that would include things like maybe a flu shot, things that aren't required for school or childcare. So you pick the right tracking schedule, then we're going to hit the immunization due. And you don't have to do anything to this screen. You just hit generate. And then It's running in the background and saying, okay, let's look at these records and determine who needs, who's due for shots for childcare. The report is running, but you do need to hit the refresh button to see the progress. So you can see now it's at 90%. Now it's at 100, and there's 2 students. So if we click, once it's done, it goes down to here. We'll pull up the report, we'll make it bigger here. And there are 2 students, Forrest and Earl. And it says Forrest is due for everything with no immunizations. And Earl is due for just the hepatitis A. And here are all the immunizations that Earl needs. Okay. So this is a great report. You can run it, print it off, cut it up, give it to a parent easily for them to see if that their child needs shots. Okay. And that is the basics of alert. I don't think there's anything else. So Stacy, back to you.
All right, thanks, Mallory. And as a reminder, stick around till the end of this video and we will give you the instructions for how you can get your own alert login if you need one. Okay, we're going to move on to how you complete the immunization reports. And we're going to talk about activities that you can sort of do throughout the year to help be prepared for completing your reports. So in the fall, you're going to want to review the immunization records for the kids in attendance at your school or childcare. And a great way to do that is through Alert, like Mallory just showed, or if you use a computer system through the computer systems assessment. And then fall is also a great time to notify parents if immunization records are incomplete. It gives parents a chance to get into a clinic, get those immunizations that are needed, and get the documentation back to you. Then January is when the report season starts in Oregon for immunizations. Your immunization primary review summary report is due on January 13th, 2021. Then 3 weeks later is the deadline for the health department to mail exclusion letters. So you turn in that report to the health department on January 13th, and they have 3 weeks to process that report and type up the letters. 2 weeks after that is the exclusion day. It's always the 3rd Wednesday in February. It's February 17th this year. And then you have a second primary review summary report that is due on March 1st this year. We'll go over those reports now. So here's page 1 of the immunization primary review summary report. And at the end of this presentation, we have a link to the website where you can find all of these report forms and also the contact person for your local health department, so you can see where to send these report forms by the due dates. And I'm going to zoom in on this section of the primary review summary form so you can see the categories here. And what you're going to do is include each of your kids in one of these categories. So I'm going to use an example that I've made up. So Stacy's childcare, and go through that example. So I have 60 kids in my childcare. 4 of those kids actually attend school and I just do after school care for them. So I'm going to include those 4 kids in the children not counted category. My adjusted enrollment is 60 total minus those 4 kids not counted equals 56. Then I need to figure out for each of those 56 kids, which of the below categories they fit into. And each kid goes in one category. And the categories are number complete, number with non-medical exemptions, permanent medical exemptions, temporary medical exemptions, incomplete, or no record. I looked all my kids up in Alert, and so I know that 50 kids are complete on their immunizations. I have 2 kids that have a non-medical exemption. I have 0 medical exemptions. 3 of the kids are incomplete, and 1 kid has no record. And then you can see 3 of those boxes at the bottom are highlighted in red. And to the left, it says, send copies of the records for the children in the red boxes to the health department and list these children on page 2. So those incomplete kids and kids with no record, I need to get them on a list for the health department and send a copy of their records to the health department. And here's where I list those kids. It's on page 2 of the primary review summary. And I'm going to zoom in on this again. And at this point, you're going to fill out just that section B over there on the left with the child's name, grade, date of birth, and address. And then make sure that you include copies of the certificate of immunization status form that the parents filled out or that you printed from Alert. Or if you're a school and use an approved computer system, you can send the printout from the approved computer system. And these are due on January 13th this year. What happens next? Well, by February 3rd, the county is going to mail out the exclusion orders for families who are whose kids are due for vaccines. 1 copy is sent to the family and 1 copy is sent to you. So you can see exactly what the child is due for and needs before that exclusion day. An exclusion day is February 17th each year, and by law, you must exclude any children if their records have not been updated as specified on the exclusion order. I do want to mention that this school year, because of COVID, there may be some schools that are doing online school in February. And if that's the case, there are 2 options for enforcing exclusion. Exclusion, if students are in online learning, can be enforced by either blocking online access until you get that updated immunization record, or by blocking return to in-person activities, which includes in-person class, sports, any special services, anything like that. So those are the 2 ways for enforcing exclusion this year if students are in online learning on exclusion day. Okay, exclusion day has passed. Hopefully you've gotten the updates of immunization records from all of your families. And then the health department, with the copies of the letters that they sent back to you, they sent back this primary review summary form, page 2, and they wrote yes or no next to each of the kids' names to say whether they had to mail the exclusion orders. And then your job is to fill out the last 2 columns with the date the orders were canceled. And that basically means the date that the parent turned in the information showing documentation of the vaccines that they needed or an exemption, and yes or no, whether the child had to be excluded on the exclusion day. And those are the last columns that you're filling out that you need to send back to the health department by March 1st. And then there's a statistical report that you have to complete. It's the primary review summary, page 3, also due on March 1st this year. You want to fill this out after all of your kids are up to date on the vaccines. So if you have kids who get exclusion orders, you need to wait until you get the updates from those families, but no later than March 1st, you have to turn this in. If all of your kids are up to date on their vaccines in January, when you turn in the first report, you could turn this report in at the same time. All right, there are different sections for different grades. The first section is for preschool childcare and Head Start. The second is for kindergarten. then 7th grade, and then there's another form that's for all grades K through 12. For today's presentation, I'm just going to do an example of this Section E for the preschool childcare and Head Start. And I'm going to zoom in on each of these little sections and break up the form so you can see it a little better. Okay, so the first question there is, how many children younger than kindergarten were excluded on exclusion day? So this is really important to make sure you fill it in, even if the number is 0, because then the health department knows you didn't just forget to fill in that field. And at my childcare program, I'm going to say that all of my kids brought in their updates before that exclusion day, so I didn't have to exclude any kids. Then the next part says, complete for children younger than kindergarten. Total enrollment, children not counted. Okay, so I have 60 kids. I have the 4 kids who I did after school care for. Here's where this form gets a little bit different. There's a line that says children less than or equal to 18 months of age. So if you have infants who are 18 months or younger, you'll put the number in this category. And then to find the adjusted enrollment only on this part, not on the first part that we already did, but only on this section, Section E, I have 60 in my total enrollment, minus the 4 kids not counted, and minus the 6 kids who are 18 months or younger. And that means my adjusted enrollment is 50 for this section. All right, number 2 says count only children 19 months and older in section 2 through 4 below. Fill in the number of children with no record, a medical exemption, and non-medical exemptions. Well, remember, this is after exclusion day and after you've gotten records from all your families. So hopefully the number of no record is no. So I'm going to say, or is 0. I have 0 kids with no records. I have 0 medical exemptions, and I have 2 non-medical exemptions. And then you'll record how many of the non-medical exemptions are from the online module or from a healthcare practitioner. I'm going to say both of mine were from the online module. All right, and here are the next sections that you have to fill out for the preschool age group. So over there on the left, I see fill in the number of children with the indicated number of doses. And it says 4 doses for DTaP, 3 doses for polio, 1 dose for varicella, etc. So there are a couple ways you can do this. You can fill out the numbers by looking at each of the records and counting if each of the kids has the appropriate number of doses as specified there. The other way you can do this is those are the number of doses for a kid to be complete on their vaccines. And if you have looked up the kids in alert and you know they're complete, then you know they have at least those number of doses. Then on the other side, it says, on the right there, it says fill in the number of children with a non-medical exemption for each vaccine. And I actually like to start on this side first. And the reason for that is usually there are fewer kids with non-medical exemptions, and it's less kids to count. So one of my kids has a non-medical exemption for all of the vaccines. And the other child only has a non-medical exemption for the varicella vaccine. So the way I count this is the child who has an exemption for each of the vaccines, I count in every single category there. And the one who has an exemption for varicella, I only count in the varicella category. So I end up with 1 exemption for DTP, 1 for polio, 2 for varicella, 1 for measles, mumps, rubella, etc. All right, and since I looked up all my kids in alerts, got record updates from all the families who needed shots, I know I have 2 kids with exemptions. In my case, I know that all of my other kids are complete for all the vaccines. So if I look at that DTaP category back over there on the left side, and I know 1 child has an exemption for the DTaP vaccine, and all the rest are complete of my 50 kids, Then 50 minus 1 equals 49 kids who are complete for DTaP. Same thing with polio. I have one kid who has an exemption for polio. All the other kids were complete on polio vaccine. And so 50 kids minus the one exemption equals 49 who are complete on polio. For varicella, I have 2 kids with an exemption. So of my 50 kids, 2 have an exemption. That means 48 are complete on the polio vaccine. And that's one way you can calculate these numbers if all of your kids either have an exemption or are complete for the vaccine. I do want to mention the all category, the child has received all of the above doses. In this case, I know I have 2 kids who are missing some doses because I have 2 kids with exemptions. So that's how I got 50 minus those 2 kids equals 48 for all. All right, and then if you do have kindergarten through 12th grade, any of those grades, you'll also need to fill out the last form, page 4, section H of the primary review summary report. And once again, those statistical reports are due on March 1st. So in March, you're going to turn in your follow-up report, and then you are all done with the immunization review and exclusion for the year. Make sure to keep a copy of those reports and any exclusion orders for a year. Hooray! It's a lot of work, and we thank you for all of your hard work in doing the immunization review and exclusion process. It's really important. This year we've seen how challenging and devastating an outbreak of a contagious disease like COVID can be in our communities. And we want to make sure that we do everything that we can to prevent outbreaks of diseases that we can prevent through vaccination. So thank you for your work in collecting those immunization records and giving families the opportunity to get that notice and get updated on vaccination at least once a year. In the spring, it's a good time to organize your records to remove the records of anybody who is no longer in attendance at your program and review records of kids who are going to be enrolling for next year to get ahead for the next year. This is a great idea. If you are a school that has 6th graders in the spring, you can notify families that they'll be due for the Tdap vaccination as 7th graders. And then there is also a requirement to share immunization rates for your school or childcare within 30 days of the start of school and 30 days after the exclusion day. And information about that can be found on the website I'm going to show in a minute. Here's a reference to the Oregon statutes and administrative rules regarding school immunizations. Here is Mallory and my contact information and email. And then I'm going to stop on this last slide here so you'll have time to get down the information that you need. So first of all, the immunization report forms are all available online. If you do download those forms online, make sure you save those forms to your computer and then type in the numbers and then save those forms again. All the other information and blank certificate of immunization status forms and other resources are also available on that healthoregon.org/school packet website. And then if you need access to the alert immunization information system that Mallory demonstrated today, please email us at oregon.imm@state.or.us and let us know the date and time that you watched this training, your name and the name of your school or childcare program, and let us know that you need access to the alert immunization information system, and we'll send you the official registration form so you can get your own login to that system. And if you have any other questions about the immunization review or record keeping process, please feel free to email Mallory or me at the same email address, oregon.imm@state.or.us.